We, we again are a place of extremes. We're a long ways away. We don't have medical school. We have the most rapidly aging population per capita in the state right now. We're not ready for it. We don't have the geriatrics training. We don't have providers that are willing to take new Medicare eligible individuals. The way it's referenced around the state is when you hit 65, you're given the bus ticket, but there's never a bus that will show up because we don't have sufficient providers. So what we're talking about today is of extreme interest to me. And Dr. Goodall, I want to begin with you. And again, thank you each for your comments this morning and your contributions. But one of the complaints that I'm hearing from providers in the state and other rural areas is that all the GME money gets sucked up by the big teaching hospitals in urban areas. And so it's very hard for us to be able to support residency programs, not only in the one urban center in Anchorage, but in the smaller towns outside of Anchorage, and very, very difficult in hub cities in rural areas like Nome or Bethel. We have, our state legislature helps pay for 20 residency slots through the University of Washington Medical School, but there's no guarantee that those 20 come back to the state of Alaska. The resident training issue for us in terms of the impact to the cost of care, it can cost one hospital in Fairbanks between $750,000 to $1 million to recruit a mid-career physician. And these jobs can take years to fill. So the point that you have made, all of you, about doctors tending to practice where they do residency really prompts my question. You left the door open to be able to speak to more of these programs that can help allow for residencies in these areas where we need the doctors. So I'd be curious to hear about more of the programs, but also whether or not you think we need to move more of these GME dollars out of the hospitals to perhaps clinics or outpatient facilities or small group practices in our rural areas. How do we avoid this concentration? Because we see firsthand that you have people who come to the state, they're excited about the adventure, they're there for a year, and then they leave. And the investment that we've made in them, we have to start all over.
Right, I completely agree with you. And taking care of the people of Alaska, no doubt, is going to require a multi-level approach. To address your first point, I think that the state of Alaska is a perfect example of where the Teaching Health Center program can make a major impact. You've got one big university hospital, and it's in the big city. The problem is most of the people that live there, and many of the people that live in Alaska, are much more widely spread. The Teaching Health Center program is a separately funded program that locates residencies not in the big university setting, but has them primarily spending their time in community health centers. So when residents go there for training, they spend at least 3 years there. They really get a feel for the community. They become connected with their patients. And especially in primary care, that's actually why we do it, so we can get connected with our patients. So having residents have the potential to make the connection with the community and their patients over time vastly increases the likelihood they'll actually stay practicing there. I also would give a shout out to some additional programs that can help provide care in slightly different ways. Dr. Phelan, I think, mentioned briefly Project ECHO, or somebody mentioned Project ECHO, which is a terrific way to leverage the expertise that is kind of based in big academic medical centers and use that expertise to train up primary care providers, not just physicians, but other sorts of providers that are more widely spread. So you can train people in how to take care of opiate addiction and how to manage complicated psychiatric illness, how to manage hepatitis C, everything. So focusing on teaching health centers is probably the single most impactful thing.
What about raising the cap on residency slots? Does that help, or are you still stuck with the fact that these people are not going to be comfortable because they've been trained, because they haven't really experienced life in that rural and remote setting?
Simply raising the cap at one hospital may increase the number of people that you have that stay in the state, but generally the data shows that people tend to practice, the majority of people stay within 100 miles of where they were trained after residency, so it depends on how widely spread you need people.
Yeah. Thank you, Mr. Chairman.